Okay, this is the use of robotics in a hospice inpatient care center with Hospice of Southwest Ohio. Wisdom case study presentation, Joseph Killian, MOL-505. Vigo is a robot that is used in all kinds of phases throughout the United States right now. Robotics are getting to be more and more practical in everyday life. In Hospice of Southwest Ohio, patients in our hospice care center are the sickest of all patients. Most have skin breakdowns because of poor dietary intake. They have edema or swelling. Most are unable to communicate as to towards the end of their life, and most are significant pain issues. The inpatient care center itself is used for treating hospice patients whose symptoms cannot be managed in their homes. Physicians in these care centers round on patients as they do in the hospital on a daily basis. The operation is a 24/7 operation. Patients come in and patients leave once their symptoms are under control. And the patients need around-the-clock care and monitoring when they are in the unit. And that's done by nurses and home health aides as well as physicians when they're around. Nursing must communicate to physicians, though, after rounds. Patient admissions, new patients coming into the care center, take place at any time and can occur after physician rounds in a care center. When a current patient experiences problems, nursing must communicate to a particular physician, and they relay these conditions by phone a lot of times, and that's typically after the rounds have taken place in the care center with physicians. The physicians really depend on nurses to communicate effectively to describe a patient's conditions or symptoms, issues, and so forth, and a lot of it can be subjective. If a patient has extensive edema, how much edema is there? If a patient has a skin wound, how deep, how large is the skin wound, or other types of issues. VGO Robotics Solutions is one answer to some of these problems. The VGO Robotics is a solution to post-rounding issues with patients because it allows physicians to see, talk, and interact with nursing and patients, I should say. Physicians no longer depend on nursing to correctly describe patient issues because they can see and talk to either the patient or they can talk to the nurse that's there, and they can actually see the edema or actually see the skin wound. It provides a virtual 24-hour, 7-day-a-week capability for virtual physician care. The Care Center for Hospice of Southwest Ohio invested in 2 Vigo robots to be used. Physician interaction with the Vigo was interesting. There was a reluctance to utilize because of the unknown technology. More readily accepted in the hospitals, it seems, where they do work, but out in the field where we are and in other locations, it's not a common occurrence to use robotics. The physicians also view hospice as a high-touch, low-tech type of industry, and they feel they're going to lose the high-touch and interaction with the patient family, and the acceptance of the patient or patient's family to the use of robotics. They're looked at also as potentially replacing actual patient care, and they want to be sure that doesn't happen. Nursing has some of the same issues with interaction with the VGO. They're not accepting of new technology as readily. It's difficult to get them over the hurdle. Concerned that physical touch of nursing would be missing. There's also the same fear the physicians had of using new technology and the fear of unknown patient family responses to that technology when it's being used. Wisdom and emotions introducing robotics to Hospice of Southwest Ohio's Care Center. Wisdom includes the ability to recognize one's own and other people's emotions and being able to restrain oneself from inappropriate emotional responses, Sternberg and Jordan, 2005. Emotional intelligence is the ability to perceive, control, and evaluate emotions of others and yourself, Keating and Harper, 2013. Using wisdom to improve the acceptance of the VGO robotics in the future. could have happened with easier rollout. Perhaps the best example of improving the rollout of BGO robots would have been to gauge emotions of both physicians and nurses as they prepare to use the robots in the care center. The use of a narrative that explained previous care center usage of the robotics and other clinical uses would have been beneficial to these clinicians as well. Last 2012. Finally, making people feel appreciated and helping them understand the benefit and technology in their roles as clinicians would have been an act of high emotional intelligence. Ingram and Kamenji in 2012. These are the references.